The NHS in North Cumbria recently had its biggest intake of new practitioners to date.
So we know that there is many workforce challenges, both nationally and locally. So to recruit 66 newly registered practitioners into our organisation is fantastic news, both for our staff and our patients in Cumbria. So some of them have been trained locally from our local universities, and some of them have been recruited from outside of our local communities. So some of them have been in education and they've registered in their chosen profession, and then they've come straight from qualifying into our organisation. Some of them have worked elsewhere and are coming to join our organisation.
The Trust has been looking at a number of ways to attract staff from other areas as well as grow their own talent from Cumbria.
So we know that if we can grow our own staff, they're more likely to stay in Cumbria. One size isn't going to achieve our workforce ambitions, so we need to use a number of approaches. So we need to attract from outside of our local region, but also retain our staff from within.
And they've been working with a transition period for local students to turn them into registered practitioners within the region.
And the purpose of that is really to start and make them feel part of our organisation right from the beginning of their learning journey. So hopefully they get that sense of belonging in Cumbria, and we really hope that that will encourage them to start and continue their professional career in Cumbria. But it gives them a real sense of belonging to our organisation.
The preceptorship programme that the new practitioners have come through assigns an experienced preceptor as a mentor to the preceptee, the newly qualified health professionals, for a 12-month period.
So I think the actual education programme itself, we've been able to streamline it. So we've differentiated between adult general nurses, community nurses, physios, paramedics. So their needs are getting met as opposed to being an overarching generic programme. And then the other part of that is ensuring that our preceptees have got a preceptor, and that's more probably for the wards themselves, encourage them to get that preceptor, which they haven't had previously.
This way of monitoring the transition period into developed professionals allows a more catered experience for the new recruits.
So I think it's being able to identify those people that maybe need that additional support. So what we've been able to do is look at individuals and give that individual the support that they need. So although it's a catch-all programme for everybody, it's very much individual to each person's needs. I think both our preceptors and our preceptees have been amazing, because it's on top of your day job. We've got preceptors that are helping our newly qualified staff to transition into roles. The level of enthusiasm and professionalism that I've seen of both the preceptees and our preceptors has been magnificent. The real credit to the organisation and to themselves.
We asked if the addition of the new staff would be a change felt by patients.
Without a doubt, what they're able to deliver and what they've been able to bring from their training, they'll make a significant difference to patients on the wards, to the staff themselves on the wards, to increase capacity.
It's hoped that the 66 new practitioners working in North Cumbria should go a long way to improving the lives of patients and staff in Cumbrian healthcare. Ciara McFadgen, That's TV.